Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne, founder and chief medical officer of Atlantic Coast Aesthetics. And Dr. Payne, we have an email question this week from looks like a Palm Beach resident, and it's a mini facelift question. And basically, the question goes like this: they want to know if they can benefit from a mini facelift, S-lift, or more complicated facelift. This person is a 45-year-old male, and they would like to know if they could benefit from just a mini facelift, the S-lift, or the more complicated facelift. They want to correct the initial cheek drooping that comes with age. They don't like the way their cheeks droop when they tilt their head, so they're just looking a couple ways to maybe make their appearance look a little more younger, I suppose. And Dr. Payne, what would you suggest in this situation?
Well, here, somebody that's 45, mid-40s male, that's a little early for facelift kind of procedures. Now, I looked at the pictures, and what we're talking about here, the person has, you have no jowling, so there's no sagging of the actual jawline. If there's no sagging of the jawline, these kind of facelift procedures probably ought to be put off for the future. Not that you can't do it, and I tell people, look, especially here in Florida, if you ask enough people, someone is going to tell you you're a candidate for it. The reality is, if you don't have the jowling going on or you don't have neck banding, you're basically just going to be getting a scar there. Now, you'll get some benefit, but you're not going to see as much of a benefit as if those things had at least started to happen. So with the different kinds of facelifts, the scar really isn't a big deal because it's hidden in almost all cases. So the more complicated types of facelifts, I would just say when you need one, you do the thorough one that's going to do the job. Some of the complicated things that involve the deeper structures and some of the more things that can put some of the nerves at risk have not been shown to be better than a standard good treatment of the SMAS, or the muscle layer right under the skin. And it does not have to be excised, and it does not have to be elevated, or it has to at least be imbricated. So that's getting a little more technical than we want to hear. But in this person, when you talk about the cheek sagging, you might be a better candidate for doing filler procedures. And there are certain ones that last a year, year and a half, and that can give you that cheek volume without getting into the issues with surgery at this early age. You could even use your own body fat if you want a longer lasting cheek filling procedure that lasts more than a year and can also address some areas of liposuction if that's a concern at this time. So I would think more toward the lesser invasive things at this age, and given what I saw in those pictures, it's not that you can't do the surgery, but that may be something for a little bit down the line. So that should cover it for you.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please visit our Facebook page or website. And Dr. Payne, we appreciate your time, and we'll see you next week.